Hi guys, my name is Dr. Lee Sung. Welcome to my YouTube channel. What if I told you lasting longer in bed is not about control, not about experience, and not even about confidence alone, but about understanding a reflex in your body that most men were never actually taught how to manage. And once you understand it, everything starts to change. Because what feels like losing control is actually a biological sequence happening inside your nervous system, your spinal cord, and your muscles, all in a very precise order. And today, I'm going to break that down for you in a way that actually makes sense, so you stop blaming yourself and start understanding what's really going on. Let's start from the beginning. Ejaculation is not random. It is a reflex, a built-in survival-style response system in your body. It begins when sexual stimulation travels from your nerves, up through your spinal cord, and into your brain. And as arousal builds, your brain is constantly processing intensity, emotion, pressure, and stimulation until a threshold is reached. And once that threshold is crossed, your body switches into automatic mode. No negotiation, no delay, no thinking it through, just a biological sequence that starts to unfold. First comes the emission phase. During this stage, internal organs like the prostate, seminal vesicles, and vas deferens start contracting. They push fluid forward into the urethra, preparing for ejaculation. And here's the important part. Once fluid reaches that stage, you are extremely close to the point of no return. That feeling many men describe as sudden urgency, or it's happening now. That is your nervous system taking over. Then comes the expulsion phase. This is where pelvic floor muscles contract rhythmically, pushing semen out of the body, fast, automatic, powerful. And this is why ejaculation often feels uncontrollable in that moment. Because at that stage, it mostly is, but here's where things become important to understand. The real control does not happen at the end. It happens much earlier, before the threshold is reached. Now let's talk about why this happens too quickly for some men. It is far more common than people realize. About 1 in 3 men will experience this at some point. But most never talk about it because of embarrassment, silence, or the belief that nothing can be changed. And that silence often makes the problem feel worse than it actually is. There are 2 main patterns. One is lifelong, where this has been present since the very first sexual experiences, usually occurring within 1 to 2 minutes of penetration. The other is acquired, where things were normal before but changed later over time. Now the causes are layered, not just one thing. Psychological factors play a major role, because once a man experiences early ejaculation, the brain starts to watch the next experience. Instead of being in the moment, the mind shifts to monitoring. Am I too close? Too fast? Is it happening again? And that internal pressure builds. And ironically, it speeds things up even more. But that is not the whole story. There are biological mechanisms involved too. One of the key ones is serotonin, a brain chemical that regulates timing, impulse control, and sexual response. When serotonin signaling is lower or imbalanced, ejaculation can happen faster than intended. Genetics may also play a role, meaning some men are simply predisposed. Hormonal factors can contribute as well, including testosterone and thyroid imbalance. And then there is sensitivity. Some men naturally have higher sensitivity in the penile head, which increases stimulation response speed. There is also a very common pattern seen in clinical practice. Men with mild erection instability often begin rushing subconsciously, trying to finish before losing firmness. And over time, the body learns that pattern. Fast response becomes the default setting. Now here is where things become important. Because this condition is not just fixed by thinking differently, it is trained differently. The body responds to repetition, not intention alone. And that means improvement is possible, but it requires retraining the system, not fighting it. One of the most effective tools is exercise, especially high-intensity training, running, yoga, or structured movement. These improve cardiovascular function, but more importantly, they improve body awareness. Your ability to sense rising arousal earlier instead of reacting at the last second. Exercise also regulates the nervous system, reducing stress-driven overactivation, which is one of the biggest accelerators of early ejaculation. Even breathing exercises and mindfulness practices help slow down internal arousal buildup. Then comes pelvic floor training. These muscles are directly involved in ejaculation control. When strengthened properly, they improve your ability to delay the reflex response and increase awareness of internal tension before climax. Now let's talk about behavioral techniques. One of the most widely used is the start-stop method. You begin stimulation normally, and just before reaching the point of no return, you stop completely. Allow arousal to decrease, breathe, reset, then start again. This process teaches your body that arousal does not automatically mean ejaculation. Over time, this expands your control window. Another method is the squeeze technique, where gentle pressure is applied near the head of the penis when nearing climax. This temporarily reduces arousal intensity, helping delay ejaculation. These techniques require consistency, patience, not perfection. Some men also use structured solo training tools in controlled environments to practice timing without performance pressure. This can help build awareness and control more effectively over time. Now, if lifestyle and behavioral methods are not enough, medical options can be considered. Topical sprays or creams reduce sensitivity at the penile head, helping delay ejaculation by lowering stimulation intensity. But they must be used carefully to avoid excessive numbness or reduced sensation for both partners. Certain medications that act on serotonin pathways can also delay ejaculation over time. These are sometimes used daily or on demand depending on the case. They can be effective, but may include side effects such as nausea, fatigue, or reduced libido in some men. In cases where erectile issues are also present, improving erection stability can indirectly improve ejaculatory control as well. Because when fear of losing erection decreases, rushing behavior decreases too. Now, the most important thing to understand is this. There is no single universal fix, because this is not one problem. It is a system of patterns: biological, psychological, behavioral, and emotional, all interacting together, which means the solution must also be layered. Training the body, calming the mind, improving awareness, and supporting biology when needed. And progress is usually gradual. Not instant, but it is real and achievable. So if you have been struggling, overthinking, avoiding intimacy, or feeling frustrated with timing, understand this clearly. You are not dealing with something uncontrollable. You are dealing with something trainable. And the more you understand your body, the more control you build over time. Now, if this helped you understand your situation differently, then don't ignore it. Start applying one small change today, whether it is breathing control, exercise, or behavioral practice, and build from there, because lasting longer is not about forcing control. It's about building it step by step, moment by moment, with awareness, consistency, and patience.